Good afternoon, everyone, and thank you for giving me this opportunity to speak to such a courageous and inspired audience today. I'm very proud and honored to address the Susan G. Komen for the Cure's Mission Conference, Ignite the Promise, and my sincerest thanks to Nancy Brinker. Nancy's leadership and determination over the last 25 years have made Komen the incredible organization it is today. We are all so grateful for her passion and dedication. The Susan G. Komen for the Cure has given a face and a name to breast cancer and given hope to thousands of women who are diagnosed each year. You know the statistics. They're staggering. 1 in 8 women will be diagnosed with breast cancer in her lifetime. It is the second leading cause of cancer death for women in the United States. I've been honored and humbled in meetings with so many cancer survivors and advocates because you know what it takes to fight breast cancer. You have the strength and the relentless commitment to create a strong support system and to understand that everyone deserves to have access to the best quality of care. Unfortunately, in many cases, this just doesn't happen. Too many women can't get the screening and treatment they need because they can't afford it, because they run into bureaucracy or technical gaps. This needs to change, and we should address these gaps now and start saving lives. There are too many women who die because they don't get the care they need. The disparities in care because of ethnic and economic barriers are heartbreaking. Komen's recent Close the Gap study shows women in communities of color have a far more difficult time getting the care they need. Low-income women and women with little or no insurance are far less likely to get that care and more likely to die. In fact, even if you have insurance, you may run into problems. And as we all know, many women facing the diagnosis and treatment for breast cancer face incredible financial challenges. I've worked for 35 years fighting for women and families, and I know we can do better. When I was First Lady, I was determined to make breast cancer a national priority. I met regularly with breast cancer advocates and helped to develop and implement the National Action Plan on Breast Cancer. I even helped promote the postage stamp that some of you know about to provide funds for breast cancer research, the first time ever that revenues from a stamp would benefit a special cause. I also launched the Medicare mammography campaign, traveling the country, taping public service announcements, urging women to get mammograms because we know they're still an essential tool in diagnosis. In the Senate, I'm an original co-sponsor of the Breast Cancer and Environmental Research Act to build NIH-funded research centers to investigate the links between environmental pollutants and breast cancer. I've also introduced legislation to improve minority health and address the persistent racial and ethnic disparities that plague our country. I'll continue to fight for programs that target breast cancer so that in the not-too-distant future, we hope and pray the incidence of breast cancer will be dramatically reduced and we'll be able to provide highly effective, high-quality treatment to everyone. To do that, we have to support funding for research, detection, and treatment. Funding cancer research and advances in technology requires that we make investments again. As president, I will support increasing the funding for the National Institutes of Health and the National Cancer Institute. As president, I will seek to increase the NIH budget by 50% over 5 years and double that budget in 10. And I want comparable increases in the NCI's budget as well. We should expand cancer center programs so every American lives within the service area of an NCI cancer center. Today, there are 18 states without a single cancer center. We also know that timely and regular mammograms can prevent 30% of all deaths from breast cancer in women over 40. I will eliminate the barriers that prevent women from receiving mammograms. I'll remove the Medicare copays for colorectal and breast cancer screenings and extend the Welcome to Medicare visit time limit from 6 months to 1 year. And I will fully fund the National Breast and Cervical Cancer Early Detection Program. We are all allies in the fight to end this disease. I know that there are many friends of mine in that audience and many brave survivors whom I admire so much. Thank you for the tireless work you do.